but I do think there's a lot of people with GI issues. It's a very, very common thing, and I think there's a lot of factors that go into it. I think genetics is some of it. I think our terrible diets are some of it. I think even like sleep, I think all of that plays a role into it. Exercise, I think all of those things play a role. We have so many artificial things in our food now that I think all of that plays a role in it. Unfortunately, it doesn't mean I'm going to quit eating cheese, but you gotta die of something. That's my theory. Okay, so GI drugs, they can be over the counter or prescription. They can either treat the disease or provide symptom relief. So treatment of GERD, which is heartburn or gastric ulcers. So what is something that treats that? Is no? Yep. No, medicine, an over-the-counter medicine.
Oh, like Pepto-Bismol?
Yep, what else? Tums. That was the old commercial. So like Pepcid, there's all kinds of over-the-counter ones anymore to treat that. But yes, laying it back all the way, sometimes it'll come back up in their esophagus a little bit and really bother them. The GI system, this is on the test, is very susceptible to emotional changes because it's innervated by the vagus nerve. And the ANS, but on the test, I'm pretty sure it's the vagus nerve that you need to know it's innervated by. So how many of you have ever had an upset stomach when you're nervous? Or feel like you're gonna throw up when you're nervous? Or, yeah. I worked with this girl that, she always called it the nervous farts. So she always said if she was nervous to go do something, she was always scared that she was going to fart. Because she's like, it didn't hurt her stomach, it just gave her gas. So I remember when she was going in to tell our boss that she was pregnant, she was like freaking out. And she kept going outside. I'm like, what are you doing? She's like, I got the nervous farts. Okay, well, thanks for going outside. So it affects everybody very differently. But emotional issues, I also think that's why we have so many GI things, because this world is emotional. It is a stressful world, and I think that just really does affect our innards quite a bit. Okay, so some different types of GI drugs. Sodium bicarbonate, that's a systemic antacid. So that means an antacid is going to neutralize the acid in our stomachs. It does have quite a bit of sodium in it. So sometimes some cardiac patients are not allowed to take those kinds of drugs. The histamine blocking agents, this reduces the acid secretion. So examples of those are the Tagamet and Pepcid, which are both over the counter. You can get both of those over the counter. And then proton pump inhibitors, again, it's going to inhibit the amount of secretion that the stomach is letting out, is the acid. Those ones are used to treat GERD and ulcers quite a bit. Prilosec and Prevacid, those ones are omeprazole. That one is very common. Patients will say that one quite a bit too. It's funny, like I have never heard a patient say this generic name, but I have heard omeprazole all the time. So they'll say omeprazole quite a bit. That's why sometimes when I say like this one is popular, I use the generic versus the brand name. It's whatever the patients say is what I tend to remember and say too.
Can you tell if somebody has like GERD in the back of their throat or anything?
Sometimes, quite honestly, I've never looked at it and been like, I think you have GERD.
Yeah, because I used to work at the little clinic, and there's a lot of people that would come in for like GERD medication, and they would always be like, check the back of the throat, but I'm like, for what?
So you could literally have like a raw open ulcer back there if it's really bad, or it could just be really red. But if you don't know they have GERD and you see a red throat, most of us are going to go to strep throat or probably right now COVID, rather than you got GERD.
Yeah.
So, but yes, like if it's really bad, you could see ulcers back in there. It would be really red and inflamed. Yeah. Okay. Any questions about that chapter?